This is what your FaceMaster machine looks like when it's right out of the box. Let's begin at the beginning by turning it over and putting the battery in. The battery slot is on the bottom, and you can see it being opened right here. The battery provided is inserted just like that. Click it shut and you're ready to go. Next, we peel off the wrapper that comes on the machine. And you can throw that one away for good. Now we can see the brains of the machine ready to go here. Insert the cotton tips fully so that contact is made with the rim of the holder. The lid comes off the area for storage of your cotton tips. Soak the cotton tips in the FaceMaster conductive solution so that you're ready to apply it to the skin. Now we're ready to turn the machine on. We can scroll through the different settings with this button. If you need to stop for any reason, use the pause button. It won't interrupt the timing of the machine. The intensity can be adjusted up or down if you don't like the predetermined settings. Okay, now you're all set. Let's begin.
Hi, I'm Suzanne Summers, and congratulations, you are now the owner of FaceMaster of Beverly Hills, which has been my little secret for the past 7 years. I've been using this religiously, and I really believe that it has changed the look of my face, not only in context of little facial lines, but also in firmness. I seem to have a tone in my face at age 52 that I didn't have 10 years ago. So this has been my little secret, and people keep saying to me, what are you doing? Well, this is it, and now you can have it too, and I'm very glad about that. This is so important to me that when I travel, which I do all the time, I never check my FaceMaster into my checked luggage. I always carry it in my purse because I figure if they lose my luggage and they lose the gowns or whatever, at least I'll look good because I'll have my FaceMaster. So to answer your questions and to show you how the product is used, I have two people who are very important to the project, Dr. Peter Hansen and Ruth Kraft. And she has administered, I don't know, thousands of these facials to people. She knows a lot about the product, as does Dr. Hansen, and I think that I can offer a lot of expertise too, because I've been using this, as I said, for 7 years, and I love the results that I've had with my face. I think it has really made a big difference in my face. Now Ruth is going to demonstrate for us. If you have your brochure with your machine, open it up to Step A. What is Step A?
The first thing we're going to do is circle around the eye.
Now we place one of the electrode probes right here, as you can see, at the edge of the orbit. Now Ruth is going to go around the outside edge of the bony structure of the eye, the orbit, in the direction that the hair grows over the eyebrow. The idea here is you don't want to touch the eye, although the current is microscopic in its intensity. You will see a little retinal flash here, and the retinal flash is completely harmless. You don't need to worry about that. Now let's go to Step B. If you're following along here, we start with one probe just below and one just above the brow itself. And as you can see here, Ruth's holding it in position. A light touch is all that's necessary. You don't need to press hard. And then you move it. And
I love this step. This gives the appearance of your eyes being more wide open. It's really amazing. And this is all very easy to do after you get used to it. And as you can see, we're having Ruth do it to herself so that you can see you don't need to have somebody administer it to you, although it would be nice, wouldn't it?
Yeah, it's handy to do this in front of a mirror initially. But, certainly for myself, not being used to putting makeup on, obviously, I was all thumbs the first few times I tried it. But this works out to be really a very neat form of treatment here.
And once you get used to doing this, you don't need to do it in front of a mirror. In fact, I do it at night when I'm going to bed. I sit in the bed and I do it to myself, and then I wake up looking wonderful.
Sort of like a closet facial.
A closet facial. Okay, now
Step C. We're going to be doing right here, and you can again see the placement of the electrodes. Ruth's doing this. Again, a light touch is all that's necessary. The little flickering that you see of her eye is perfectly harmless. along with any flashes that you might see.
Now, following along in your brochure, go to step D, under eyes.
This is actually over eyes, just over the
Yes.
top, right here. And again, you'll see your eye might feel like it's doing a little blinking on you here, and the flashes, again, that might occur, perfectly harmless. There we go. Easy as can be. Now we're going to move on to step E. Ruth is about to place the electrodes again, or the wands right here. And as you can see, she's going to be going out towards the temple and holding it. That's it. And again, replacing just like so. Good.
Okay, now we're going to step F in your brochure.
This is for the glabella, which sounds very complicated. It's just the center point between your eyes.
This thing here.
Right in the center, right between the eyes.
Yeah, if you don't like that part of you, this will
There we
smooth
go.
it out.
Doesn't take long.
Okay, now Ruth has finished one half of her eye. She's going to now repeat the same process on the other eye to real time, so you can do it along with her. Okay, Ruth, she dips it in the solution.
And we start at step A. There we go. And again, you see it's going in the same direction as the hair growth on the eyebrow. And you can just follow along.
And how many times does she go around the eye?
10.
10 times.
10 times around the eye.
Okay.
Now we're ready for step B.
Under the eyebrow and over the eyebrow.
Notice how she's pushing up on the brow a little bit with the lower probe. Holds it still,
In each position for 10 seconds.
and then she moves
Or
it
if
over.
you have your beeper on.
And then she moves it to the next position. And again, don't be alarmed when you see any blinking of the eye. That's quite involuntary and quite harmless. You'll also note, again, the retinal flash. But that's one of the reasons why the machine has the intensity pre-selected to be quite low when we're going around the eyes, just so it won't feel any, you won't feel any discomfort. And remember, when you're doing this, you can always turn down the intensity on your intensity dial at any point if you find that what we have pre-selected for you is a little too high. Conversely, you can also increase it if you need more. Ruth's got just the right amount there. Good. Now we're ready for step C.
Yes.
Okay. That's it.
So that's right next to the nose and near the end of the
It's at the outside corner and the inside corner of the eye,
Right.
lower eye.
For
And
10
again,
seconds.
it's the orbit of the eye. You don't go anywhere near the actual eyelash. That's it. The orbit being the bony cone around which the eye is inserted. There we go. That's step D right there. Okay, great. And we're doing the temple here. Looks like you're winking at us here. That's good. Okay, and do the other side. Great.
It doesn't matter what probe you use.
No, there's no left and right or
Right.
positive and negative.
Okay.
It's already predetermined that you can use both. There we go.
Okay.
Now we're on to,
Step F, which
there we
is the
go.
final.
Again, working on that glabella. Great. Now, of course, if you have problem areas in certain parts of your face that you want to give more emphasis, you can always spend more time on those. But this is designed to be a flexible system, and that this is a great way of
Would that
going
be,
about
for
it.
instance, if you had a severe furrowing of the brow here, you might spend a little more
Yeah.
time on that.
Exactly.
Right.
Okay.
Okay, now we're going to the face on your brochure, and there are 15 steps to the face because we have a lot of parts in our face.
Face is very important.
Yes.
You'll notice when you change the setting on your machine that there'll be a different intensity indicated on there, and that's because the machine, with the brain, already knows that we're going to need a little more power to treat the face than we did around the eyes. So Ruth will start off and show us through step A. You can see the placement of the wands is right in the midline. She's only moving one wand and then holding it for 10 seconds. There we go. Now we change positions, same deal again.
It's almost like you're stretching, you know, you're pulling down and under.
Exactly.
You know what I found also while she's doing this step here, over the years that I've been doing it, I push mine up to the highest intensity because my face can take it at this point. And also I find that you get to know your own facial structure and where you like more definition.
Or problem areas too.
Or problem
certain
areas
people have
too.
certain areas that need more work. Step B. Good. Starting just underneath the edge of the bone, the lower jawbone, and moving up to about the level of the upper teeth.
Okay, now we're going to step C on the face.
It's a good thing you did a show called Step by Step. Now you see that the upper wand just by the side of the nose, and it pretty much stays the same. The lower one is along the edge of the lower jaw, and it's the one that you'll be moving. 10 seconds each step. The beeper that's provided on the machine will help guide you through the timing. The timing isn't absolutely critical, but it's a good idea to have the same applied to both sides of the face. So
I think 10 seconds for each step. It really works the best.
it really does.
But if you're in a hurry, you can cheat a little bit.
That's right, as long as you do the same both sides. There we go. As you can see, it's the lower jaw line that we're following here, but keeping the upper probe still by the side of the nostril there. That's the idea. Okay. Now we're ready for step D. For step D, you'll notice that we're getting that pouting effect on the lower lip.
So you can have those model's lips.
That's right. Or just look petulant. And again, 10 seconds is what we're holding here, as you can see. And it's just, each probe is basically just below the lower line of the lip. That's the idea. Now, this is step E. We're going on just above the lip line on the upper lip.
It's
And
one of
again,
my favorites.
this is a dandy one.
But it does. It gives the appearance of an upturned mouth.
It gives the appearance of a guppy,
Of a
just while you're doing it.
Again, I do this in bed at night while I'm watching television, so that I do two things at once. And once you get used to it, you don't need to have a mirror.
This is step F. You can see the placement is at the upper lip. Both wands are on the same side of the midline, and there's a bit of a pinching or squeezing from one probe to the next. So there'll be a little outpoaching of the skin between the two. Don't have to press too hard, but you can feel the gentle pressure on the upper gums underneath.
I like that one. That's the one that makes your lips go.
That's right.
Without collagen.
Now we've got step G, and again we're above and below the angle of the mouth. And again you can see it right here. That's the idea.
That's how you'll smile up.
That's right. Everything we do is
down.
everything we do is 10 seconds at a time. There we go.
Well, this is all, you know, as you age, gravity pulls your face down. So what we're doing is giving the appearance of the face going up.
That's right, an anti-gravity machine. Okay, now we've got step H.
When you first do this, do one side of the face first so you can see the dramatic difference.
Now this is just like when your grandmother used to pinch your cheeks and say, "Isn't that a cute little boy?" Same idea, and that's the sensation you'll feel. There's a little ridge. The upper one of these two wands right now is just on the edge of a ridge that you can feel on the side of your face, and again, that's a 10-second hold.
Yes, you can feel it's like right in there. You kind of almost something to grab onto there.
That's right.
Which, by the way, nobody ever said what a nice little boy about Ruth and I.
Oh well,
when we were-
I
when
should
we
have
were
modified
children,
that.
yes. Okay, these are steps I through M.
Step I starts just under the eye, needless to say. Ruth's not winking at you, folks. That's just part of what happens here. Don't be alarmed.
And the other one is under the cheekbone.
The
correct?
lower, it's very important that the lower wand be basically secured underneath the edge of that cheekbone, as you can see, and you can press fairly firmly there.
Yeah, and
Again,
you'll
show us
feel
through.
it. You know, it's like you get a grip of your cheekbone, and it really gives it a great appearance.
And you can almost, again, see a bit of outpoaching of the cheek itself because the lower probe is pushing quite firmly there. These are steps I through M, so we're on J, that one we just saw there. This is K here. And again, the lower probe doesn't move. The
And
lower
this
probe is the same.
this works great for men also. So after you use it, then you can loan yours to your husband.
This will give you those
My,
apple...
my husband uses mine. The apple cheeks?
The apple cheeks,
Yes.
exactly right.
I do that, and then when I'm putting my makeup on, I put a shader underneath the cheekbone there, and it really looks pronounced.
Now we're on step L. There we go. And again, 10 seconds as we go. And remember that the lower probe doesn't need to be moved much. It's the upper one. The lower one's still the same, always underneath that bone. And that's M. Now this particular placement here is just below the cheekbone. So actually both wands here are touching just below the cheekbone. There we go, and again, 10 seconds. So now we've done right through to M. Here's for step N. We've got one wand, the lower wand is placed just at the base of the nostril, and the upper one is just below the inner angle of the eye. And again, do not be alarmed by movements that you see here. Perfectly normal, perfectly harmless. Okay, now that we've done the lower 2/3 of the face and the eyes, we're going to move to step O. This is above the eyebrows. And start in the midline with two wands right in the center of the forehead and draw them apart and hold them. Sort of like a stretching kind of a movement. And you may feel a little tapping on the top of the head. Do you feel that right now, Ruth?
Yes.
Okay, don't be alarmed again, folks. This is all quite harmless. And for this step, we're going to be moving across the forehead, as you can see here, in intervals.
It seems
this.
like a lot of steps on the face, but actually it's not. It's just that we have many different parts of our face. And after you get to know your own facial structure, it goes very quickly.
There we go. And again, we're just moving across the brow like this. 10 seconds in each spot. This is a dandy one. Hey, that's good. So now we've done 4 different, we've kind of divided it into fourths right above the brow itself. That's the idea. Good.
Okay, now Ruth has finished one half of her face. Now she's going to do the other half in real time so you can do it along at home with your own. Okay, here we go.
This is step A.
Step A is on the chin. It's pulling.
And you can run this video each time you do it for the first few times, too, until you get the hang of it. But as Suzanne said, eventually it becomes as easy as dental maintenance and dental care, just something you do as part of your routine.
Mm-hmm.
There we go. That's
It
step
makes
B.
such a difference in your appearance. I wouldn't think of going a whole week without doing it. And you will find that, too, in a very short period of time. On the days that you do it, people say, gee, you look good today. Gee, what'd you do? What did you do? I get asked that all the time. It's quite dramatic.
And Ruth, you can tell us what step you're on next.
B.
B.
Now we're on step B.
B of the face.
There we go. And again, you can see that the upper probe is up to the level of the teeth. The lower one is just below the jawline. That's good.
This firms this whole area down here, at least on my face.
When you think about how much time people spend on their hair or other parts of their daily routine, this is really just an 18-minute idea, or an 18-minute effort that you need to try once a week. It's not like you have to do this a couple of times a day or anything.
What I love is the firmness. You know, I find as you get older, there's a mushiness to the face that I see. That because I'm not doing that, because I'm using this machine, I'm not seeing that mushiness happen. You know what I'm talking about? I guess it's gravity pulling the face down, and the fat drops, and people get jowly, and this kind of keeps it firm and high.
It's that youthful-looking appearance we're all trying to
Firm
get.
and high.
Well, indeed. Of course, the nice thing
This is
about
step C. Step C.
Yeah. Other side of the
The
face.
other side of the face. Yeah.
You got to remember which side of the face you're
Yes.
on. That's good. This is step C. Now, the nice thing about this, of course, is that it can be done anywhere. You can take it with you on trips or throw it in your suitcase. It's ideal to have good lighting and a mirror initially when we're starting, though. Just bear that in mind.
But it fits in your purse. It takes up no space at all.
It doesn't fit in my purse.
I don't like to do it on the airplane because people watch and say, "What are you doing?"
Oh, that's
but,
right. Conversation piece.
I have found that I do it now when I'm doing something else, and mainly watching television. That's a great.
That's how easy it can be.
Yes, I put the news on, or you know, the Nightline show, and
Instead of knitting, you're doing this.
yes.
There we go.
I'd rather buy sweaters
There
and
we
have a
go.
nice, firm, taut face.
We're now going into step D.
If you notice, before each step, Ruth dips the cotton swab into the solution again. If at any point your cotton swabs get kind of funky
Or even dry.
or dry or whatever, and
You
or
could
you want
either-
to change them, at any point you can pull them out and put clean ones in, and just dip them into the solution before you start. It doesn't have to go all the way down, just on the tips is okay.
Step E.
And again, these steps have already been done on the other side of the face. There's no harm in doing them twice, because these are important areas.
Sometimes when I'm going to something really swell, or going to do the Tonight Show or something like that, I will do the whole process twice, just to get like that extra kind of thing.
Oh,
And then
that's
people
right.
say, "You look good."
This is your secret.
Yeah, this is my secret.
Step F.
There we go. And again, you can see
Make
a
that
little,
little smile go up,
you
up,
can see a
up,
little
up.
pursing of the upper lip there.
Well, if you look at little children, watch their smiles. Little children's smiles go up. Youth is up. It's gravity that pulls faces down. When you look at people who are older and usually unhappy, I find.
Wiser.
Wiser, you'll see that the mouth turns down. So this sort of helps it to go up.
Step G.
There we go.
I don't know if I think it'd be better like this.
There we are. Okay, good. You're doing great. Actually, you wouldn't believe it, but Ruth's got a 22-year-old son.
You would believe that.
Yes.
Okay, now we're doing step H. Plump up those
That's the
cheekbones.
cheeks. And again, that's that grandmotherly grip on the cheek we're looking for there. That's the idea.
Or those apple cheeks.
Mm-hmm. You bet. And again, 10 seconds. Now we're ready through steps I through M.
And this is step I.
Notice that the lower probe is in that hollow underneath the cheekbone, and the upper probe is on the inner aspect of the lower eye.
J.
No need to touch the lash or even come that close to the eye. We're still on the top of the cheekbone with the upper probe.
This is K.
Very good. Now we're doing.
L.
There we go.
And M.
Great. See, once you get going, it doesn't take very long. Now we're ready for step N.
As in Nancy.
There we go. As in none too difficult. Now we've got this one again. The lower part of the upper probe is on the inside edge of the lower part of the eye area, but not touching the lash. Now we're ready for step
O.
O. For this one, we put them, remember, it's in the center of the forehead, and draw them apart to separate them. That's the idea. And we've got 4 different lines to follow above each brow. There's the second one. You basically just divide the forehead in fourths on each side of the midline. Great. Are you feeling any of that tapping?
Yes.
That's good. And remember, you can always adjust the intensity up or down if you find that it's not adequate, or if it's giving you too much sensitivity. You can always make these fine adjustments. There we go. Just like a professional.
So that side of her face is done. So now we're going to the last step, of the whole facial, which is the feathering.
And Ruth will show us the basic technique here.
You just want to, any line on the face you can work. We'll start here. We'll put one of the probes at the end of the line and then work across the lines.
So it smooths it out.
And again, the machine is designed to be flexible enough if you need to go over certain areas with greater attention than others, you can do so. It's only the one probe that's moving.
And if you have time, the longer you can do this, the
Better.
more effective it is.
That's right. That's,
Now, I have found if I get a little blemish or something, if I feather over that, that it sort of speeds up the process.
there we go. This is great for around the crow's feet areas of the eyes.
I've seen a big effect on my face of the crow's feet. Like I was saying earlier in the video, 10 years ago, that these lines were much more pronounced than they are, and I have to believe it's because I've been using this machine for so long.
Oh, that's great. Of course, we always admonish our patients to stay out of the sun and away from too much of the alcohol and bad things for the skin, but that's just part of good health maintenance.
Well, also, for people who smile a lot, we
There we
get
go.
crow's feet.
That's right. And crow's feet are nothing to laugh about. There we go.
So, laugh, then feather.
That's right. And again, as you can see, basically just following the probe that's doing the zigzag is just following along any of the lines of the face. We're just we're conforming with the normal position of wherever wrinkles might appear. It almost
Even though you're feathering with one probe, you always keep the other one grounded on the,
That's
on the
right.
face. It's very important. Both have to be touching your face at the same time for it to be effective.
and if you're predominantly right-handed or left-handed, you can use whichever feels more comfortable for you.
And I'm dyslexic, so nothing is comfortable. So that's why I keep using it on the back of my head.
There we go. That's great.
See, you wouldn't believe that Ruth is 94.
There we go. And again, the other thing we always remind our patients about as part of good skin maintenance is wear sunglasses.
Yes.
So it stops you from squinting too much.
Now,
if you're
there's
out in
one
the
little
sun.
thing that I do. This is my own little thing. When I'm all finished, I've done the whole thing that Ruth has done. I don't know why, it just seems to finish it off. I ground it here in the center of my face, and I follow the jawline here. And I do the same thing over here. And then I take it here, and I follow the cheekbones up here like this, and the same thing over there. And there's nothing scientific about it. It's just that, as I said, after you get used to this machine, you start finding your own ways to use it. I find that it just gives like a final smoothing. So try it.
Sort of a final dusting on the cake, as it were.
Do you dust your cakes?
Yeah, they're pretty old.
And that's it. We've seen Ruth do her entire face. You look beautiful, Ruth. And I hope you enjoy your Face Master. I'm sure you'll see results very quickly. I love my Face Master. Write me letters if you like yours. And I thank you very much, Dr. Hansen and Ruth, for being such a good sport. Enjoy. Bye-bye.